Hello, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created HealthScore. HealthScore is a comprehensive program to optimize health and extend life. In my over 10 years of practice, I've been able to improve the health and support increased lifespan for thousands of patients. HealthScore is based on 31 recommendations identified in the peer-reviewed medical literature to be the most important contributors to health and longevity. Today we're discussing, in the domain of psychological health, recommendation number 4, foster an optimistic attitude. So what does it mean to have an optimistic attitude? Let's look closer at the definition. Optimism is commonly defined as a tendency to think that good things will happen in the future. Researchers have gone further in their ability to determine an individual's level of optimism. This is called the Revised Life Orientation Test, and I recommend you stop the video and take it now. Please indicate the extent you agree with each of the following items. Write down the number in the box corresponding to your answer for each item. Then add up the numbers to determine your life optimism score. It will be anywhere from 0 to 24. You can interpret your score using the table, where 0 to 13 is low optimism, 14 to 18 is moderate optimism, and 19 to 24 is high optimism. I'll share with you in a moment what that means for your health. Now that you understand what optimism is and you've been able to assess your own level of optimism, let's look at the evidence that optimism matters. What is the evidence, if any, that optimism promotes health? The evidence for recommendation 4, foster an optimistic attitude, comes from this study, which you can find in PDF format in the resources section. In brief, this was a systematic review and meta-analysis published in JAMA Network Open in May 2019. The researchers looked at over 2,000 adults with an average follow-up period of over 13 years. The outcome of interest was, does high optimism result in decreased risk of death? The investigators found that high optimism did indeed reduce premature death by 14% compared to those with low optimism. And you can see in this graph here, high optimism, no increased risk of death, low optimism, 14% increased risk of death in the follow-up period, and having moderate optimism was intermediate in its effect on risk of death at about 7%. The mental state of being optimistic has thus been shown in a large systematic review to reduce risk of premature death. The higher a person's optimism, the lower the risk of premature death in the follow-up. The lower their level of optimism, the higher their risk of premature death. How could it possibly be that an optimistic attitude actually affects your health? Well, let's look at possible mechanisms. Optimism has been shown to affect an individual's health-related behaviors, as well as physiologic processes in their bodies. These two pathways account for the reduction in mortality and the improved health for those who have higher levels of optimism. People who are more optimistic are more likely to eat a healthier diet, be more physically active, and be less likely to use tobacco. On a physiologic level, individuals who are more optimistic have less inflammation, less hemostasis or blood clotting, which is the cause of heart attacks and strokes, improved endothelial function, which also reduces risk of cardiovascular disease, longer telomeres, and longer telomeres directly relate to longevity. The telomere length predicts lifespan. The longer the telomere, the longer the lifespan. Improved cell repair and lower levels of stress hormones, which lead to lower blood pressure and less risk of diabetes and obesity. Now that I've described the way in which optimism promotes health, the question is, can you change your level of optimism? Is our level of optimism something we're born with, or something that is formed during our childhood, and there is nothing to do about it? The evidence from the medical literature is that optimism is a mental state rather than a trait, and it's modifiable rather than fixed. So how exactly can you improve your level of optimism? Well, there are two ways: the self-help route and with the help of a therapist. In the self-help route, there's the best possible self-exercise. This is the intervention that has the most evidence in the medical literature for being effective in multiple studies in terms of a self-help intervention. This is how it works. It's a writing exercise that consists of 5 minutes of journaling each day for 2 weeks or 14 days. Each day, you write a paragraph about how you imagine your best possible self in the future. In this paragraph, you include how you imagine your best possible self in 3 areas: your personal life. In the best case scenario, how would your personal life be? Relationships. If your relationships were optimal in the future, how would they look? And professional life. In the best possible case, how would your work turn out in the future? That's just one paragraph. And after 5 minutes, stop the exercise, return to the journal the next day, and imagine again your best possible self and write down what you think. If you do that exercise, taking out 5 minutes a day for 14 days, it's been shown in clinical studies that you'll experience an increase in your level of optimism. Not only that, but that increase is sustained in the long term. You actually remain optimistic. Another option to consider is therapy. A lot of times people who are pessimistic about the future have what are called cognitive distortions. They think in catastrophic terms, like nothing will ever work out for me. Part of what therapy can do is to uncover these underlying assumptions and predictions and actually test them in the real world. Is it true that nothing ever works out for me? Let me try again and test that hypothesis and see what happens. With therapy, specifically cognitive behavioral therapy or CBT, you can challenge your pessimistic assumptions about the future. To find a therapist, you can look on your health insurer's website to find a provider and network. I also provide a link in the resources section of this lecture, which is continuously updated with reviews by patients in my practice of therapists they're currently seeing. Many of these therapists are conducting treatment online. So even if you don't live in San Francisco, it's likely you'll be able to find a provider on this list who is doing televisits across the state lines. There are no frequently asked questions for this topic. Summary. What we've discussed is the definition of optimism, how you can determine your own optimism score. We talked about the meta-analysis showing how optimism lowers risk of death. We explored mechanisms, both behavioral and physiologic, for the improved health seen in those who are optimistic. We talked about how optimism can actually be changed over time, and I provided tips, the best possible self-exercise, and cognitive behavioral therapy. I also provided resources to find a therapist. I hope this video has been helpful. Thank you very much for listening to this lecture, and I wish you the best of luck in improving your outlook on life. Thank you.